My name is Heather Hayes. I am a physical therapist at the University of Utah, a multidisciplinary ALS clinic. I'm here today to discuss with you stretching. Stretching is going to be one of the most important pieces for you to do for home exercises on your own. The reason why we want you to stretch is to help reduce pain and maintain flexibility. This disease, as it's affecting the motor neurons and not the muscles, means that you may have a loss of active motion in your hands. For example, your hand may be curled. So I'm going to be going over things that allow you to stretch the hand. The hand wants to naturally rest in this position, for example, and if you're not able to open the hand actively, then I need to make sure that you have the ability to continue that range of motion. There's reasons why we want you to continue to stretch, is to make sure that for hygiene purposes, we don't end up with the hands contracted. Same with the shoulders. We want to make sure we maintain range of motion to reduce pain. And I'm also going to explain it through the ankles and the knees and the hips. When we think about stretching versus exercise, stretching is passive, and an exercise or strengthening is actively contracting the muscle. For example, this is an action where I'm asking the muscle to work. If, for example, that motion is no longer there, or this is an active motion, I still need you to be able to passively perform that activity, meaning somebody's going to help you. So this is the action, and if I assist, then it becomes passive. But I want to make sure you continue to maintain that range. So today I'm going to go over the exercises through different body parts, and I'm going to show you how to do them if you are capable of standing and doing it on your own, versus you may need assistance and how your caregiver can assist you, or how to modify stretches along the way. So each muscle group will be divided into different parts, and you can decide which one might be the best for you. I will primarily be giving you 6 exercises for 6 different areas of the body that I want you to stretch while we continue along this journey. So the first area that I want to think about is the neck. With this disease, sometimes the neck, we're not moving our head as much as we can. If you're somebody who's in a wheelchair, you may have difficulty moving the head. You may find that your neck has more weakness than it is used to, and you're tending to hold the head up. So if you early stages of the disease and you're capable of moving your head, I just want you to take the time to rotate the head to the right and to the left. You're going to just do the stretch a few times, getting the neck used to moving. You can also look up and then look down, and then head to the shoulder and to the shoulder. If this becomes more difficult for you, you can ask your caregiver to assist you. And in that example, somebody's going to help hold the head and rotate the neck gently. All stretches should be pain-free within their range. If we find that the neck is tight in this position, then just gently take some time to stretch it and not go too aggressively with it. Go within the pain range, but about 10 motions to help just stretch a little bit will help relax the muscles just a little bit. Okay, our next exercise that I want you to focus on is shoulders. Oftentimes the shoulders, they are heavy. They can be what we call subluxed. We want to make sure if you're losing some of the muscle mass in your shoulder, that you continue to nourish this joint. It is one that we're used to reaching overhead, so I need you to continue to do that. To start in your early stage disease and you can reach overhead, spend some time really making sure that you can reach overhead. You can use both arms to help you reach overhead. We can also do this laying down, and I'll show you in just a second how to stretch the shoulders. For people who have a harder time and they are seated, what I really recommend is when they're in the shower, make sure that the joints are warm, and then we can take the arm into a flexion posture, which just means that you're going to take the arm overhead. And again, I want this to be pain-free. And up and down for a couple of motions. Having the joints be a little bit warmer beforehand is important. The reason why we want to make sure that we do these shoulder stretches, if we're trying to put on a sweater or something and the person does not have the range, and you then take the arm into an awkward position, it can be very painful and can set us back from having to feel like we should not be having the pain as a result of addressing compromise. So the first stretch is just an up over the head. This is called shoulder flexion. I want you to be sure that you keep the thumb up in front of you. And you can do both arms, again, kind of gently holding it at the top of their range, but also coming in and out to make sure that we are nourishing that joint. The second stretch that I want you to do is take the elbow out to the side a little bit from the body. Once the shoulder is aligned, I want you to rotate the arm around. This is called external rotation. We are now rotating the glenohumeral joint, the ball and socket right here. We are rotating it outward. The reason why we recommend this is the most important area for not making sure we don't have pain. If the individual does have pain, I want you to make sure that, or we find that the shoulder is subluxed and drooping down, don't do either of these exercises. Make sure that you work with your therapist on how to approximate, make sure that the joint is in motion, it is in alignment before you do these exercises. But for someone who is trying to maintain their range of motion, these two stretches would be the most important: shoulder flexion and external rotation. If you were to lay down, I'll show you how to do these in case it's harder for somebody. So if somebody is on their back, they can hold on with both hands if they would like, and take their arms over their head. Again, gently stretching. Keep in mind, if they don't have the strength to pull it back down, you do want to help them bring the arms back down. But this is active plus passive, helping the individual get that range. When we do our external rotation, I do want you to make sure you keep that thumb up. If we go into external rotation, you're going to bend the elbow out to the side of their body and then rotate it back. You can hold this position just a little bit. The key is to make sure the elbow is not all the way in, but pull the elbow out and then rotate around. This is sometimes better if they're subluxed because gravity itself is helping to put that joint back into place. next muscle I want to work on is your hand muscles. You may have noticed that you have some weakening in the hands, and the hands tend to stay curled. We can put you in splinting and bracing, but in the meantime, what I really want you to do is make sure that we're keeping the hand as open as possible. Again, make sure that the hand is warm and the joints are warmed up. You can use a rice bag or a hot wash rag to be able to hold on to make sure the hand is warm. When you stretch the hand, you're basically just trying to stretch the fingers out so that everything is in a neutral position. Don't overstretch, which would look like you're just hyperextending the fingers. And the other thing I'd like for you to do is to stretch the wrist a little bit. When you stretch the wrist, the fingers do curl down. If we don't stretch the wrist as high, we may find that we can then extend the fingers. Ideally, you want to extend the wrist a little bit and extend the fingers. This can be very painful though, so I need you to make sure you go slow. If somebody is in this posture, most I'm looking for is that they can end up at this posture. This would be what a healthy person can do, as long as we're getting a little bit of wrist extension, wrist up, and finger extension. That would be best. Don't forget our thumb. Thumbs tend to get caught in clothing, and we want to make sure that it is stretched and not painful as well from just not being allowed to move. You can also, just at night, make sure that the hand is resting on the thigh, trying to open it up, and somebody can just help press the fingers down and try to keep it open. If that's too much, take it to from the knee, let it curl over the knee just a little bit, but then try to slide it back if you can. Again, keeping it warm will help stretch the hand. Next, I want to work on is your hip. Oftentimes, in early stage disease, you are still walking around. I want you to continue to walk around. The stretches that you would do would be a typical runner stretch where you take one leg back and you're stretching the hip forward, trying to stretch here. What happens over time is if we are more in a prolonged seated posture, our hip flexors, this front muscle, may become tighter. So I want to make sure that we continue to stretch this. Ideally, for somebody who is sitting more, we want them to be able to lay flat. So I'm going to have you lay down on your back. And to get the overall hip motion, we want to be able to stretch the hip in both ways. I want you to notice if somebody is sitting, this is basically a sitting posture. But we always do need to make sure that we're kind of stretching into the hip, gently moving it back and forth. This is a good stretch for somebody to help you with. If you are capable of doing it yourself, you can just hug your knee. You can just bring the leg up and hug your knee. Doing this every morning is a great stretch before you get out of bed. It can help with stiffness in the hips quite a bit. If you do need assistance, then we come in just gently back and forth, moving the hip into this motion. But more importantly, I want somebody to be able to lay flat. Now, if they can't lay flat because of breathing, it's not so much that I need you to be flat. It's that I want this hip flexor to be nice and elongated, otherwise it can get painful. If someone is capable of laying down, then the other way that you can get your hip flexors is have them move a little bit toward the edge of the bed. And this is probably the easiest way to do it. Drop a leg off of the table. And then don't just drop it, but now you're going to feel it in the front of the hip, and you're just letting the leg hang down. I can certainly provide more by having it hang off the leg, hang off more, and a little bit more through the behind the leg. On the top of the leg by stretching the foot behind. That's a very aggressive stretch. They may not be able to pull their leg back up, so be sure you assist with pulling the leg back up onto the table. If that is a difficult position to get into and you're capable of it and you can go onto your stomach, that would be the next step. This may be too hard to lay on your stomach, but if somebody can lay on their stomach, now I have the opportunity to really stretch through the hip flexors. In this posture, I can also get to the quadriceps by bending the knee. This is often very difficult for individuals, but if you can do this early on in the disease where you have a little bit more mobility, this is going to help maintain that flexibility. You're trying to bring the leg up as far as possible. Some individuals are able to reach back, use their arm to grab their foot, and that would be the ultimate stretch for that. The other thing that you can do is if you are early on, and you can lift the leg up, now we're starting to get a lot more flexibility in through the front of the hip to be able to stretch there. So all of those are the same type of stretch. Okay, another area is hamstrings. This is an area that's often tight because the legs are down and we're not stretching it as much. This is tight on many people for many reasons. And the first thing you can do is just rest your leg, one leg at a time, up onto a table. Somebody else can also help you with stretching and just lifting the leg up. Oftentimes this is difficult. If I was to do a laying down position, which would be ideal, person lays on their back. You can either bring the leg straight up, this is called a straight leg raise, and it's stretching behind on the hamstrings here, which is the back muscle of the leg, or you can come in with the knee flexion and then lift the leg up. She's demonstrating, this is a very, very good flexibility. Where I would really start this is down just a little bit, probably to here, make sure that they feel good. And if they can't stretch the leg all the way up, that's fine. They most likely are going to be feeling a stretch behind the leg. The last stretch I'm interested in is your ankles. Ankles, like the hands, may have some weakness, and that foot drop that you may see. So she may be dropping the foot. And since you can no longer lift the foot up actively, then we need to make sure that you passively maintain that. If we end up with tightness and the muscles are too tight for you to be able to stand flat-footed, that's the reason why we want that. This is going to help you with your transfers. The first stretch you would do, again, is just a runner stretch. You're just trying to keep the knee straight and bend the ankle. The other way that you can do that, though, is assist somebody. You can do this in their wheelchair or laying down. You just take the ankle, press up against the foot until they feel a stretch behind the calf. This is probably, if I had one that's really, really important, this is going to be one that's very important to you, as well as the shoulders and the hands. Those are the areas where people typically are not getting as much range, and it just feels good. Sometimes we have swelling in our feet. Providing this motion and using more of a pumping action, which is what your body used to do when it was walking, and getting that motion back, this can help to get some of that fluid out and also can feel good. You can help just provide some of that massage as well to help with the fluid out.